So thank you very much for this opportunity to talk to you today. I'm going to focus on herd health, and I want to bring home some principles. So maybe just 4 slides quickly, a little bit about myself. Kobus has already said that. So, how can you do all that? I'm only 63 now. I'm 63 young, compared to that other colleague of mine, that Madala. You know which one I'm talking of? Who am I talking of? The other vet. Fafa. You know that man, he's timeless. He's got no off button. Dr. Fafa Malan. A lot of respect for Fafa. So how do you fit the 18 years in? Well, it's quite simply, in that period, you also do other projects and other things. I'm not 100 years old, because if you had to add all that up, I need to be about 100 to reach all those objectives. So, all right, so that's just a little bit of background. So, in my venture to do the Vet2Farm, now, who of you eat KFC? Come on, man. I know you cattle farmers. Please, Tito, thanks for being honest, eh? A lekker roener on its time is most lekker, eh? With that lekker fat and crispy and the chippy and all that stuff. So, so the difference or the resemblance between the owner of McDonald's, my apologies, KFC, who started that was who? It was that Colonel Sanders guy. He was an old fellow when he started late in his career. So all I'm just saying that there's maybe a chance for me as well, starting late in my career with the Vet2Farm. Okay. So animal health, traceability, biosecurity, those are fields of interest that I have and where we're going with the Vet2Farm service. And all right, so that's quite easy. You can see it there, and I'll show you the last slide. We'll also end off with that. So that's my handle, right? Vet2Farm. Okay, so today it's a privilege to be here to talk to you guys in terms of livestock health. I'm going to talk about herd health, some principles. I'm going to cover a lot of ground because just to talk about a small component, in my opinion, is not enough. So we'll just whiz through a couple of scenarios. All right, so today, tomorrow I'll chat a little bit about the bulls, and I'll also address, Kobus asked me to address like a medicine kit or an emergency kit. What do you kind of need to think of keeping on your farm for your cattle? I'll touch on that briefly for you as well. Right, so in herd health, what needs to be done? So we use the principle of what needs to be done when and in time. And a couple of the slides in here should tie up those principles. So I like to use a planner, a year planner. And I think it becomes pretty obvious just now why. There are different health categories that we address in such a year planner. Because you forget these things, nah? I'm going grey and I forget a lot. But you guys with baie eisters en die vure, you're farming cattle, you're farming maize and soya and this and that and everything else. You have a lot of things on your hands, on your forks, so you forget these things. So a planner helps a tremendous amount to keep direction. So breeding soundness, because that's part of reproduction, we'll touch on that briefly today. And then nutrition, I always like to say, even though I'm a veterinarian, the most important thing here today for all of you is what? Ma'am? Food. You need food. You need energy. Okay. So you can't run any beef herd, stud, commercial, nothing. You can't run them if your nutrition plan is not up to scratch. And we've had Dr. Mias talk about the felt and the felt quality and looking after it, etc. So livestock nutrition is a very important part of the animal's health. Okay? Good. So I'm just using where the company I used to work, I actually designed that for them. That is a year planner. It's about this size. It's about so. Okay, and you put it on the wall. So what I like about that, and I know that you have a lot of electronic stuff. We have a lot of electronic stuff in our hands and our cell phones and our computers, desktop and cloud-based. But when you fill in a form like that and you put it on the door there, it's visual, it's in your face, and it's guidelines for you. All right, so that is something. Maybe you can contact that company and talk to their reps, and maybe they can help assist you to get hold of a planner like that. All right, so in a planner like that, we like to split the program into components. So I basically use 5 groups or 5 components. One, it's a no-brainer, you guys can read better than I do, is vaccines. Then you have got dip and dose. So what is dip and dose? That's your ecto and your endoparasites, the worms and the ticks and fleas and lice and mites. Okay, how do you control those? In the dosing, you also have other parasites like liver fluke. When is the best time or strategic time to treat for liver fluke? So those are in there. And then the number 3, even though it's small there, that's the small little things which are still important, like the identification, certain trace vitamins and minerals. Those are small things, but they still play a very important part in the total herd health. Okay, and when you get to that point, I think some of them will become obvious. And then we have our breeding and procedures. That's very much targeted towards the bulls. Okay, and then I touch off or have a slide or a section where I have a chart that's filled in with nutritional guidelines. Okay, whether you agree or disagree with it, put that down as a guideline or parameters that you can consider. Right, so we got the 5 groups, got the 5 main groups, and then we've got the months of the year from Jan through to February. And in the chart, where possible, I try and structure that whatever I do with the cattle, I try and almost work like as in a feedlot. I try and process all the cattle with whatever I need to for that month on the same day. Why? Minimize stress, minimize handling, minimize days out of felt. All right, so I really try and put all those things together. Okay, so in the first one, in most of these categories, in these action groups, like the top one, all those arrows pointing to the right. Here we're referring to the vaccine section. So that whole section there's all about vaccination and the immunity of your herd. Now I break it into calves. The first line is from birth, from 0 basically to 6 months age. Then the second line, those calves drop down from that line to the next group from 6 plus to 12 plus months. And in the third month or the third line, I drop them down. They go into my, let's call it my replacement heifers. Be they from 12 months plus, 18, and it all depends. That table obviously differs depending on where your calving season falls. All right. So, and then obviously I have a line for cows and a line for bulls. Now we don't have stoer, osse, and all that in here. That's a little bit different. It's quite easy to apply, so I've not included them in here by default. Okay, so just had these 5 categories. All right, so who knows what we mean by virus shedding? Anybody heard this terminology before? Right. Maybe a bit of a thorny issue. For 2 years, you all wore masks. And why were you wearing masks? Because everybody was scared of virus shedding. Okay. So one can have a nice talk about that part in history, but the basis is virus shedding basically means that when an animal is infected, it is shedding virus. Okay, it's passing virus particles out. So where are viruses shed from? Generally, many. The nose, the mouth, now the respiratory system. But can viruses also be spread through other parts or other orifices, ander openinge in the animal? Which other openings can viruses be passed out? The rectum, the urinary system. Okay, so all the orifices out, nose, chest, out, reproductive, the guts, viruses can be passed out there as well. But in this way here, what I find important is to take note of especially respiratory virus shedding. And I really focus on that a lot because it's something that we need to be aware of and that we can manage. Okay, so in cows and bulls and heifers, there are certain times when they are more susceptible to this virus shedding. And associated with the virus is that when viruses grow in an animal's body, or in a human, when that virus is growing and you have lots of the virus particles there, we refer to it as a phase of viremia, okay? Meaning that the virus is now in growth, there's a lot of it, it's shedding, it's present in the environment because the animals are infected. So this viremia will become a bit more obvious just now. So other things that are important in terms of the breeding season is temperature reaction. So what happens when it's hot today? It's not hot today. I've been here in Paris, on the Val, Paris, that gets pretty hot here. So when it's very hot, what do cattle start doing? They start panting, start breathing faster, because they don't really lose a lot of weight through skin evaporation, do they? They have to actually blow it off, right? So they have to breathe the temperature off. So when they're breathing a lot like that, what happens to the animal's pH? You can go into an alkalotic situation where the animal becomes more alkaline because it's breathing off a lot of the carbon dioxide, and then the blood urea nitrogen levels are affected as well. Okay, so if animals take in too much nitrogen, that's one way. The other way is if they're blowing a lot of heat off, can affect the pH of the blood. Not that much that you could really measure it drastically, but with a measurement tool, but it makes a massive difference on the cellular level, in the microscopic environment, i.e. in the testis or in the environment where the sperm and semen are, or in the area where the ovary is shedding the egg cell, passing the ovum, and in the uterus. Okay, so in the factory, the cow, that change in either BUN or alkalinity has an effect, right? So even acidosis on the other extreme can also have an effect, because on a microscopic level, the survival of that little embryo is dependent on a fairly stable temperature, a fairly stable pH. So temperature can have a massive influence on conception per se. Right, so semen, ovum, embryo, and fetus, so that's why I put those question marks there. Okay, so now that I've set a couple of parameters there, the next part is, I always say to farmers, and now, you know, us guys up front here, we like to ask questions. We like to say, who is? Mias, where's he? Where's Doc Mias? Mias, waar is jy? Right, he's raised his hand. Well done. So, you know, he was asking all of you who are farmers. So it was his turn now to raise his hand. So now I'm not going to ask you who are farmers. I just want to know, who of you also produce maize or sorghum? Dankie julle. Appreciate. I can see, but I'm you know, just like everybody else to see that a certain percentage are livestock, others are plants, and others are a mixture of the two. Okay. So I think with the farmers who do the crop farming, this picture, hierdie kan julle verstaan, né? Die mielieboere hierso. Right, so that's a small mealie plant, and I also like to say, like a mealie plant or a young pasture or something that you're trying to get to grow, a lucerne field, there are certain things you need to do to that young plant to make it strong, to last, and produce for you what you need it to do. So, with the cattle, we have the same approach. So there are certain things we want to do and make sure that that young calf, that we're preparing that calf to give us good production in its life. All right? Good. This 0 to 3 months, we will just touch on maternal antibody effect a little bit later. But you'll see these are the young calves. And at this stage, they are taking in a lot of milk. How quickly after calving must a calf or any non-primate, in other words, all the mammals like cattle and doggies and sheep and all those, how long, for what period after being born do they have to consume colostrum to absorb the best amount of immunoglobulins from that colostrum? Okay, this is a question. The one who gets closest to that gets one of these. Today, Kobus said I can give some prizes away. Here are some Zoetis products here. These you might recognize are antibiotics, tetracycline. And so, for Motso, I think what we need to do here, we need to give the farmers the first chance. So non-farmers, you're disqualified by default. Farmers are allowed to answer here. So, hoe lank na kalf, right, hold your hand there, hoe lank na kalf moet hulle colostrum inneem om die beste hoeveelheid in te kry? So, hou julle arms op, because that man jumped you on the side there, came in from the blind side. 6 hours, all right, so he's spot on, but what were you going to say? 6. Okay, I'll keep you in line. If he's disqualified for some other reason, then the next one gets the prize. Is that fair? And what was your answer at the back? How many hours? 6. Yeah. So the guys who know, they reckon that it takes 6 to 8 hours. Then the animal's digestive system then starts consuming that colostrum. Okay. So then that colostrum is now not absorbed as antibodies anymore, but it's now digested as amino acids and converted in the liver and the body into metabolites, which are put together again in the muscles. Okay, so, well, let me give you your prize, because otherwise I might just forget. I'm going to be a spoil sport and only give you the small one. Don't worry, I'll make a plan. All right, so he's got a small bottle there. So that's a period. So it's very important that your calves and lambs are consuming that colostrum. All right. That colostrum then, once they've taken it in, only remains viable in that calf system for about 3 months. I don't have a graph here for it, but if it takes it up, it goes up like that. Within a day, it's high, and it stays high, and by 3 months, ka-ching, it falls to a very low level. That 3 months is critical to keep in mind. When do you guys start vaccinating your cattle for certain diseases? At what age do you start vaccinating? 4 months, 5 months, 6 months. And what are you doing there? You're just doing the standard Clostridium, spawn sick, lamb molt, isn't it? Well, I'm saying isn't it? I can be wrong. But that is a trend that's out there. That's what we learn. But you need to change your game plan a bit. You need to move to the left of the calendar a bit more. Go closer to the 3 months. I'll elaborate on that now. Okay, so we like to look after the calves. We want to prepare them for the challenges that come forward. So at 0 to 7 months, what happens? So now there's 7 months. Let's say when they reach 7 months age, what starts happening with most calves? They get weaned. And you keep your replacements, and you keep your animals that you want to sell to somebody else. Stud animals, you also start your selection at the stage, and you also start throwing off your weaker animals. All right, in terms of your criteria. So at this stage, that animal is fully susceptible to many of those diseases that are out there. All right, with heifers, 6 to 12 months, weaning plus. So this all relates back to that calendar that you saw, okay? And then, of course, in your cows and bulls. So on the left-hand side, you'll see cows, calves, and bulls. So that's kind of in your breeding season. And that is what I call a sensitive period. That's a sensitive period in your reproduction cycle. And there are 1 or 2 tricks that you just need to keep in mind when you are at that stage in terms of what you are going to apply or vaccinate. And I'm focusing here on vaccination, what you're going to vaccinate your female animals and in that period. All right. So those are sensitive periods. And then what about the pregnant heifer or the cow that's pregnant? Is she not also potentially sensitive? Sensitive to what? Sensitive to temperature changes, sensitive to fever, sensitive to viremia, a high presence of viruses circulating in the body. You guys have heard in various places I've been in the last 2 months, that one of the topics is, what's that disease that starts with 3? Is this a very difficult one? Shall I give this the next prize? First one that comes up with what disease starts with a 3? Come up and get your prize. I'm not going to walk after you. You thought... Thanks, Corbs. You thought I was going to walk after you? I shouldn't. You're the younger one around. you can have this one, okay, the big one. Okay. That's because it's a difficult question. All right, so 3-day stiff sickness is a virus disease, and yes, there is a company that does have a vaccine, and I've heard some people say it's working, it's not working. I think it's working, but I think just purely because our cattle have not been exposed to a virus vaccine like that, that we have a lot of susceptible animals at this stage. So yeah, 3-day stiff sickness with the rain has increased drastically. And so if a cow gets 3-day stiff sickness and she's pregnant, what are the challenges? Of course, there's a possibility of either resorbing the embryo or the fetus being aborted. But what do you do when the cow's heavily pregnant? She gets that, she goes down and she battles to stand up. So 3-day stiff sickness is important. What about bulls? Sê weer? Ja, 3 dae stywe siekte. Ja. Nee, alle beeste. So first of all, the lady asked a little bit more about the disease. So 3-day stiff sickness is just a name we gave it. Because when the animals get this virus disease, which is transmitted by mosquitoes, predominantly in the summer months and late in autumn, they develop a virus infection, they develop a viremia, lots of virus in the body, a temperature, and that virus creates a tremendous inflammation, and it's felt also specifically in the joints, can even cause joint damage, permanent joint damage in some animals. So that cow, wat gebeur met daai koei of 'n bul, gaan lê. Hulle is so vrek seer, hulle kan nie opstaan. So you can come to a Chickie, Simbra, Brahman, whatever breed, if you've got a Chickie bull or a cow, they are so sore you can actually jab them on the ground with the Jovas, with the antibiotics and the anti-inflammatories, anti-metabolic stimulants, and by tomorrow it's magic and they're up again. All right. The bull or the cow that lies longer than 3 days, 5 days, a week, 2 weeks, if she reaches 2 weeks or he, most often you'll find they have got joint damage inside due to this inflammation from 3-day stiff sickness. All right, so it's not like a disease that happens every day and every year. It's been absent for a couple of years now, but in good rain, mosquitoes, moisture, up goes the concentration of that disease. Right, so 3-day stiff sickness. Question? Okay. So just some practical comments on that. 3-day stiff sickness, if the animal is there in the veld, don't try and get it up and force it to walk to the crush. It's pretty stiff and sore. You can just catch it with a rope, restrain it. 1 or 2 people, 3 people will hold a big bull like that normally in the veld quite easily. You jab it there in the veld. You wet it with water. You pour water over it just to get the temperature down. It's not going to get pneumonia from that water. But we give antibiotics to suppress or minimize potential secondary pneumonia that they can get from the virus and the infection. So we still give antibiotics. Okay, the antibiotics cannot stop the virus. Nothing can stop the virus. It has to be vaccinated beforehand. So jy moet die koeie ingeënt hê om dit te voorkom. So ons behandel dan net symptomaties. So we're treating symptomatic that this bull can get up or this cow can get up and go and eat and drink. Because what does the animal die from if it doesn't get up after 2 days or by 2-3 days? Dehydration. Okay, so all of you, you're welcome. I see you have got water. I'm not sure who sponsored it, but thanks for keeping this bunch of people hydrated here. All right, so they have to take in water. Very important. Okay, the next one is, yes, it's detailed, but the next slide will come forward a little bit. So what we do is, and I've noted that in the literature it says, consult with your local veterinarian. Consult with someone in animal science or from one of the vet pharmaceutical companies. Your first call should obviously be your vet. We've always preached that. We still preach and practice that because the vet generally is your most experienced person who understands all these diseases. Right, so that is an example. That's my example. That's an example I used in the years that I was working at MSD to train and teach salespeople that when they interact with you or with veterinarians, that they can talk the language, they understand what's going on, and that they're not talking nonsense, okay? So you have a program which is structured and put together scientifically for specific reasons. So let's go to the next slide. No, I'll have to go one back, my apologies. This one is smaller. Okay, so at the back, you guys, it might be small for you. I'll try and just run through it with a pointer. That November, December in this program is when the cattle are calving. So I've chosen November, December, Jan as like the calving season. Okay, it's just a guideline. That little mark you see there is when the oldest calves that are born are 1 month old. So when that one is then 2 months and 3 months old, I'm not going to ask a prize for this. How old is the youngest one in a 3-month calving season? He's 1 month old, right? So when that one is 3 months old, we work, or I and other vets maybe, we work on the principle of the 70-30, meaning hoeveel van die koeie het gekalf, hoeveel van ons sal graag hê, so 70-60% van hulle moet al ten minste in die eerste maand gekalf het. You want to have at least 60 to 70% of your cows calving if you've got a calving season calved down in the first month. One, it helps a tremendous amount when you're doing things like vaccinations. Because the calf that's 1 month old, if you apply vaccinations to that calf, your vaccine effect might not necessarily be where it's supposed to be, especially when that calf has received a lot of good colostrum. The colostrum can kind of block it from absorbing sufficient antibodies that last long enough. Okay, so the way I explain that to people, I say, when you've got a crib there, water crib, the ball valve in it, and you've got a big water tank at the top, how full is the crib where they're drinking that has a ball valve? It's only as high as the wall and the ball valve is. And the immune system kind of works on the same way. Even though there's more antibody available, they have X amount of storage capacity. Okay. And when that ball valve goes down, that water will run out at some time. Okay. So generally, the antibodies will sort of last a year. Some will last longer than a year, 2 years, or whatever. There are obviously exceptions to that. Okay, so we try and vaccinate the first calves at 3 months of age. So here, there's heart water and heart water. So that is an optional. If you had heart water blood, that would be the right time under a month of age if you come from a heart water area and you're applying heart water blood, which at this stage is a bit of a challenge, supply-wise. Okay. Then the next ones that you do with the calf, you start looking at respiratory disease. Here I've just mentioned 2 products. There happened to one product which is a dead vaccine, which I like a lot in the sense that it's safe, okay? But why I've used it there in this one is that if I was to apply that respiratory vaccine at 3 months of age, I can then also apply it to all the other animals during pregnancy, because here they are pregnant, my apologies, here they are in the mating season. So I don't want to fiddle here unnecessarily with a live virus vaccine. However, if I've got the herd primed, if I've got the herd sensitized, next year, if I've got those components in there and I want to use a live virus vaccine, then I can consider using a live virus there. Because I've now already primed those cows. The immune system now already recognizes those viruses, and the chances of them of developing either a eierstok, an ovary inflammation from the live virus, here specifically IBR, is less because her immune system is already sensitized. If I now suddenly come into a cow herd and I want to jab the calves and I also jab some cows with a live virus, I run the risk in a small percentage of those cows of losing those embryos or fetuses, okay? Because the live viruses like IBR and BVD, if the cows have not been pre-sensitized or been vaccinated before, potentially can resorb or abort those calves. Okay, not like 30%, a smaller percentage, but every percentage that you lose, the value of cattle today is significant. All right, it's very significant. So then I can use a dead vaccine. I can run it through the whole herd, even though the bulls are with the cows. So the bulls, the cows, the replacement, and then those ones. Okay, there's nothing here because they've moved on. Then a month later, I'll repeat that as a booster for them. These ones are just getting the annual vaccination. That one I'll boost it. That's a respiratory vaccine again. Then by 5 and 6 months, I start doing other things. At the top there in the fine print, you'll see RVF. Now, RVF is Rift Valley fever. So, slengdalkoors. Now, there used to be 2, alive and a dead. They are not really readily available. If they are, that's great. Grab them, use them. So, remember with the live RVF, die lewendige slengdalkoors, Rift Valley fever. I mentioned an insect just now. Sorry, there are no more prizes now. The other prizes are for tomorrow. Okay. What insect transmits RVF, Rift Valley fever, slengdalkoors? Mosquitoes are here. Right. Great. So mosquito is die hoofoordraer van slengdalkoors. Okay? So in this good rains like now, Rift Valley fever can become a problem. It is less of a problem in cattle than it is in small stock. Okay, in small stock you will have deaths of the adult animals and you'll have masses of aborsiestorms. Okay, nes en zooties aborsie in skape en in bokke. Rift Valley fever, slengdalkoors kan vir 'n klein vee regtig aborsiestorms veroorsaak. Okay, vrektes van die volwassenes, maar klomp oeye wat lammers afgooi, slengdalkoors. We don't have that kind of a scenario in cattle, so once again you'll also have the odd one, and then also remember, Rift Valley fever through small stock and cattle is a potential zoonosis. So when you have abortions in this time, not just brucellosis, but you need to think of Rift Valley fever. So safety when you're working with that material, gloves or whatever, and disinfecting your hands and arms afterwards, not putting your hand in your mouth when you're working with that dead fetus or calf lying there. Be careful not to expose yourself unnecessarily. All right. Good.
What is a zoonotic sickness? Say this, but mense kan kry.
Van die
Enzootiese sickness. Mense weet nie wat dit is.
Yeah. Okay. So Kobus asked a very good question. What is enzootic? So enzootic just means it's in the herd. But the word I think that we're looking here is zoonosis. So zoonosis, when a disease is a zoonotic disease of a zoonose, it means it's a disease which can pass from an animal to a human. Sometimes also from a human to an animal. But generally in our scenario, it is the diseases, or they are the diseases that we get from the animals to human. So just to name a couple of these zoonotic diseases, we have what? Brucellosis, besmetlike misgeboorte. Slengdalkoors is another one. Right. Chlamydiosis, chlamydia in beeste en in skape, sheep. When they're abort like that, you can have enzootic, you can have a zoonosis, a zoonotic disease, which can be transferred from animal to human. All right. So that's what a zoonosis is. Okay, zoonose. Oordraagbare siekte. Okay, so when we get to this stage, April, May, and these animals are 5, 6, going 7 months here, you'll notice that here the calves, we start vaccinating with a botulism, anthrax, and a multi-clostridial vaccine. Yes, there are base Clostridium vaccines that contain anthrax and normally just contain 3 things like miltsiekte, lamsiekte, spoorsiekte, anthrax, botulism, and Blackwater, all right? That's a base vaccine. That's a good vaccine. But if you want to minimize your risk, if you want to take a broader risk strategy to minimize it, then you start upping your game and you start using the multi-clostridial vaccines, okay, where they run up to 10 components in them. And there are 3 diseases which, at the end of the slideshow, which I'll maybe touch now so that if I run out of time, the one batch of them are the Clostridiums that affect the nervous system, okay, the senuweestelsel. So what do you think, what disease, if I say nervous system, what diseases can you think are caused by Clostridium diseases that affect the nervous system of the animal? Okay, not rabies. Okay, that's a virus. When you feed chicken manure, what jumps to mind? Lamziekte, botulism. When you feed a bale of hay or something that in a wet year you've baled and you haven't allowed it to dry properly, or beans or anything like that, and it muffs, it starts to rot inside, botulism. Okay, so botulism normally causes paralysis, but you get acute botulism with animals taking the feed today, tomorrow, the day after, they're dead. They're not even being paralyzed. They're okay today, tomorrow you walk in there, tomorrow there are 41 animals just lying on the side. That's acute botulism, okay? Then, of course, you have got the spoorziekte types, which we'll get to now. The other one that causes more in sheep, you don't see so much in cattle, is that one where they get all stiff like that in the legs. So when you put the rubber ringetjies on the scrotum and on the tail, castreer and sterkies afval, those ones, they can cause tetanus. All right, so those are the two nerve poisons that these Clostridiums have. Then they've got about 5, these Clostridiums have got 5, call it roiderms if you want to, in cattle and sheep and goats, where these bacteria affect the gut. All right, so they've got different names, which I might address later. So those are ones that cause damage in the gut. They're very acute. Acute meaning it's vinnig, it's fast, okay. Today they're okay, tomorrow they're dead, right? From these bacteria poisons. The bacteria produce poisons. Then we've got the ones that cause gangrene or swelling. Okay, so those ones, the old one is spoorziekte or black quarter. Okay, but it has two, 3 brothers, if I can call it as such. One is Clostridium sordelli, which is hartslag. Okay. Hartslagspoorziekte, so that is a kind of a gangrene which affects the lungs, the liver and the lungs, my apologies, the lungs and the heart in the front part. And then you have the one in the uterus of ewes and cows called Clostridium septicum, so-called kwartaardige baarmoeder spoorziekte. So post-calving, post-lambing, if they don't have an immunity against this, the odd cow or ewe can develop this gangrene from this bacteria through the bruising in the calving process. Okay, so then they get so-called Clostridium septicum. Okay, so fortunately for all of these Clostridiums today, versus 60 years ago, we can vaccinate. We can minimize, we can reduce the effect of these diseases on the herd. All right, so we start priming them, they get a primer, then we give them a booster. And you'll notice, so we give the booster to the cows, assuming that the cow and the bull herd are on the same level of immunization. Dat hulle ook al voorheen geënt was, 'n primer en 'n booster, of 'n primer en 'n skraagdosis. Okay. As hulle nie gehad het nie, dan moet hulle Nessie kalvers eerste inenting kry en dan 'n maand later 'n skraagdosis. Van daar af kan jy dit net eenmal 'n jaar, dan hoef jy dit net eenmal 'n jaar te herhaal. Okay. Right. So in here, you can see we are basically processing almost everything in there. So if we've gone through the program, and by the time we reach here, the calves are already sensitized, the cows are, you put them in the crush, you do almost 2/3 of your whole year's vaccination in one day. So you only need so much fridge space, you only need to order that once, you don't have to keep tons of medicines in your fridge, vaccines, for when you're going to do that, you order it, you get it done, job done, and then that's done for the year. Okay. Now, just another point. In this period, what I would like to see is that more farmers start programming or preconditioning their calves, especially those of you. Do you keep all your stud calves? No, you don't. And a lot of your calves or your bull crop or your heifers go out to other cattle producers. So the whole game, or the whole objective of the beef industry is to produce beef out there in mass. And that eventually goes through a background, eventually goes through a feedlot. And where we are still experiencing challenges, morbidity, which means sickness, and mortalities, deaths, is because calves come from the pasture and they have not been immunized as early as this 3-month period for the respiratory diseases, the lung diseases, and also all those Clostridium diseases that I've touched on. Because we only start vaccinating them on the day we're kind of weaning them, almost. And that's a little bit late. So if you can start concentrating in putting in these vaccines a bit earlier, remember the guys who buy the calves from you, cattle from you, and I'm not talking a cow calf that are going out. They know where they buy the calves. So I can look at this batch of calves here and say, yeah, but these weaners are looking great. They're all red weaners. Great, I like them. Why am I going to buy them? Because all the same color, look nice. Okay, so I buy them. But I know this guy that I'm buying from, here's a mottled bunch. There's some white calves and brown and red and whatever, and they're all here. But I buy these calves before I buy these ones. I'm just using this as an example. Because the difference between these nice, either black calves or white Charolais or Rooibos, Maras or Simbras that are here, this mottled bunch here, there's one difference. This guy, this farmer, is doing this preconditioning already starting early with the vaccination program, especially for the lungs and the Clostridiums. So when they go through the whole weaning stress, the whole auction, on-farm auction, or going straight to wherever, background or feedlot, they go through masses of stress. And some of these calves arrive there and they develop pneumonia or they develop red gut syndrome. Okay. And so we lose some animals that actually die, but we also lose in terms of production. So you might say, no, but it's not important for me because I'm not the guy who's feeding them. But remember that today with electronics, ICT, information communication technology, computers and software and all this stuff and identification, those guys know exactly where they buy those calves. And so they know whose calves they will gobble up first. All right. And that's the difference between the mottled bunch and the mooi rooies of the rooi Drakensbergers or whatever is here, because visually this batch looks more uniform. But from an immunological point of view, from an immunologische standpunt, from them having been vaccinated, this batch, he was too skimpy on his vaccine and he just wanted to sell Kobus. I'm pointing at you. So he's just selling them on how the breed looks and all that. But when they hit that intensive environment, it's a different story. Okay, so I'm the buyer. So guess which batch I'm going to buy? Kobus, ek gee with 3 dae price. You want to sell the calves? Okay, I'm giving you extra in a kilo. I'll take them immediate. So that's how it happens. Believe me, those guys know exactly where. All right, good. Then in here, you'll notice CA 4 to 8 months. So that's contagious abortion. So when you vaccinate your animals and you're trying to minimize, you cannot ever with the vaccine prevent the animal from getting the disease, but you minimize the effect of the abortion. So jy maak jou aborsies minder en daardeur verminder jy die verspreiding van die siekte. It's also a zoonotic disease, ook zoonose. Right. That disease, so for calves, with the RB51 of MSD and the S19 vaccine that's out in the field, you can vaccinate both of those in that time. After 8 months, you cannot vaccinate the smooth strains. They normally have an S in their name, like S19 or S whatever. That S just means it's a smooth Brucella bacteria strain. And those ones, the tests that are available, don't have the ability to differentiate between the field strains, which are also smooth, and the smooth vaccine strain. So al daai beeste, as julle sou toets, vir al die verse 2 tot 3 maande nadat hulle gekalf het, because in the period before calving, they are not that accurate for testing. You cannot go up there and say, oh, I've tested these heifers, and then put your name behind that and say, you guarantee 100% that these heifers are clear from brucellosis. You can only kind of start certifying if the cow herd has been testing negative for the last 2-3 years. Then by assumption, you can say, or association, you can say, probably these heifers are clean. Because generally in the lab, we can have that the lab picks up once the heifer is calved. Then the lab starts picking up these brucella antibodies. Okay. Whereas the RB51, this one you can keep vaccinating after this 8-month period. If you vaccinate the S strains after 8 months, and I like to say do it at 6 months, don't go that close to that 8-month period, because you can potentially create your own false positives that bite you in the bum later when you test them. All right, so if you do the smooth strain, do it roughly at 6 months of age. Okay, don't go too early because then you don't immunize properly, and don't go too late because then they drift into the false positive group. All right, so that's for the smooth strain, and you can only give the smooth strain once. You cannot give it again later in life. You cannot give it after that as a booster. Then they will start turning false positive in the lab. You bite yourself. The R, the rough coat brucella vaccines, you can give a booster and a booster. You can even give a booster to the cow post-calving if you have a challenge around you. Those cows will not test positive for that in the test, because the tests are designed to pick up the smooth strains. Okay, and the smooth strains equals the same as the field strains. All right, so that's very important. Good. So we do the brucellosis vaccination, and then in these heifers at 10, 11 months, you can see even as a young animal there, 5 months, we can start 3-day stiff. And here we are now looking at boosting Rift Valley and 3-day stiff. There's no danger of any reproduction challenges here because they're not at the bull yet most. Okay. And then this one, trike, vibrio, lepto. There are different vaccines out in the field. Even if you are doing AI, vaccinate your heifers and your cows with a trichomonas and a vibriosis vaccine. Right? Cloete have got one which is on the market. It's not a bull vaccine. You give it to the female animals. And what we're doing is we vaccinate the cows, the heifers and the cows, so that if a bull that's infected with trichomonas or vibriosis, and even some of the vaccines have got a lepto strain in, but the trichomonas and the vibriosis are the venereal diseases of cattle which affect your pocket. So of the two, if you were not able to get one of the two vaccines, I'd rather want to be able to inject trichomonas vaccine than I would a vibriosis if I had a choice. So what I'm saying to you is the most important one here is the trichomonas vaccine. Vibriosis is also important because both can give you abortions. But trichomonas causes infertility in the cow, infertility in brackets. The cows develop a uterine infection, and it takes a couple of cycles for them to clean out. The bulls carry it, the cows can also carry it, but the bulls are the bigger carriers of it. In other words, the oordraers van die siekte, by carriers. And the cow doesn't come on eat, so she starts drifting out of your bull season. So intercalving period, and you can have a herd that's 95%. And I know I spoke to a guy in the Free State about 7 years ago, and he said he had a herd, he was at 95%, and he dropped down to about 48% calving percentage. Okay, so that takes you from 0 to 0. You're just farming for free, mahala, there afterwards. Because if you lose so many calves in one season, that's a tough knock. Unless you've got some other farming component carrying you, if you're just a beef farmer and you get trichomonas into your herd, it can wipe you out. Okay, can really have a massive effect on you. So that's a very important disease to look for and to vaccinate timeously. It's a dead vaccine. You can give it to pregnant cows, anything. But the idea is to give it so that the cow develops an immunity before the breeding season. As jy eers die immuniteit aan die gang het, dan onderhou jy hom, en dan soos wat jou bulseisoene kom, dan is daai koeie op 'n baie lae risikovlak vir trichomonas. Okay. That are inbreeding, or heifers that are inbreeding, until they've been sensitized to those respiratory and reproductive diseases, IBR and BVD. Because these are new vaccines out in the market, and so you need to just consult with either the vet pharmaceutical or the veterinarian to make sure that you know how to put this into your herd. Okay, right. So you give a primer there, that one is once, and then here there are other Clostridium likes, and this Somni is a bacteria which has always been there, but as of late, in the last 5 years, the Somni containing vaccine brands have become more available in the market. So Somni is a pneumonia. It's a one that you might find it on your farm, but it's something that also goes through to where they grow and fatten the cattle. So Histophilus somnus is a respiratory disease. And so there we would give one there. And then in this one, we could then bring in this Bovillus vista C7 as an example, because that's just Clostridium. There's no respiratory component in it. Daar's nie IBR en BVD in daai een nie. So hy's veilig vir koeie in 'n teelseisoen. Right, so it's just options. So there are many options out there. It's like you stop at one garage and you've got what's a petrol? Leaded and Ultra, and this one's a 93 and that's a 95. They're very close. So if you're in doubt, contact the professional people who know these things and can help you to put them into your herd strategically. Okay, right. So we then go through that, we vaccinate that, and then if we want to use something here, which now starting to come onto the horizon, is the L's. The L's are the Leptospira. These are bacteria which affect the urinary tract, they affect the system, and these Leptospira bacteria can cause a variety of symptoms in cattle, okay? From urinary tract infection to a general infection causing illness, and often they're also associated with rats and rodents. So jy het almal voerstore, so rats and rodents can carry these diseases around more than the cattle themselves will spread it. Because the rats and the mice run and jump on the feed and the lick and all that stuff in the store, and they urinate and they mess there, and so that's an ideal place for Leptospira contamination to occur on feed, and even the feed you mix yourself, you're going to put that into your cattle. Okay, so just be careful of that, and that's a discussion for another day. All right, so this table basically just refers to there are a multitude of dip and dose products out in the market. I want to focus just on two issues here very quickly. When we have these calves that are 1 month, 3, 4, 5 months old and then going down, here is a product called Solution. But there are other insecticides. These are the things that contain ivermectin, abamectin, doramectin, etc. And normally you buy many of these injectable insecticides which kill lice and mites, the blood and lymph-sucking types, sheep scab, blue lice, maggots, anything that sucks blood or lymph, blue ticks. These injectables normally come, and of course roundworms in the intestine, they normally come as a 1%. When you buy these ones, it doesn't matter which vet pharmaceutical company's product you buy. If you buy the 3% and the 3.5%, 3.15% of these insecticide products, they are extremely good products. But because the levels are high, and if you treat calves, be careful. You will notice that in the program, we don't put any insecticide into calves 1, 2, 3, 4 months, potentially up to 5 months of age. Because the higher percentage there potentially have side effects, toxic effects on them. So when you're treating the cows, you can use a 3%, a 3.15%, a 3.5%, but together with that you take a plain 1% injectable insecticide, ivermectin, abamectin, whatever it's got in there. The percentage is lower. So whoever's running ahead in the crush, you jova the cows and the bulls with your long-acting because you want to suppress the blue ticks. But for your calves that are 5 months, 4 months younger, you have a bottle specifically containing whatever 1% insecticide you want to use. And you jova those baby calves with that 1%. It's very safe then. Okay. So stay away from giving a syringe with a long-acting insecticide to anybody and saying, here you are, and go and jova the cattle. And he runs down and he does them, because when you're not there, people will not change the valve. It's sun, it's hot, and it's windy and dusty. So what do? They just run through the whole lot, and they jab them. So if you jab that calf that's weighing 90 kgs, the same dose as a cow that's weighing 400, 500 kgs, how many times are you overdosing? And you've got a product that's very strong. So when you use the long-acting ones, it's for weaner and older, with good safety margins. And the baby animals, you don't go higher than a 1% on them. And baby, I would push it 4 months, even up to 5 months. Okay, right. So that's as far as the insecticides are. So that's injectable for internal roundworms, for sucking lice and mites, and blue tick control. By blue tick control, when you inject these insecticides, unfortunately on the box it says control. It controls ticks. So what happens? The farmers jova the animals, and then 2 weeks later, or 3 days later, they phone the company that does it, say, your product's not working. The product is working. It takes 2 weeks and a couple of days to get the blue tick count down from 100% that are on the animal right down to very close to zero. Never ever will you have zero, but close. Right. It takes two weeks and a bit. So they have to suck a little bit every day, and so they start dying off. You will not have that you jab them with the insecticide and tomorrow they're all clean. So with the contact poisons that you have, the water-based, like the amitrazes, the ones that contain amitraz or deltamethrin or organophosphate, the ones you mix with water, contact doders, you spray today, tomorrow generally the cattle are clean. Okay? The oil-based ones, they normally take 4 or 5 days to get sort of clean. All right. The injectables, they take longer. Okay? It's good that that is dipped. It's like a sign to cut off. So there are other things on the slides that I could have shown, but I think time's running out. When we come to the bulls, in terms of the breeding, when you are going to have a vet come and examine your bulls, make sure you have not vaccinated these modified live viruses like 2 weeks, 4 weeks before the vet comes out. All right. Because you have the potential of these things causing lower sperm quality. Okay, so any of those things, I would make sure I have it in my herd health program that I finish vaccinating any live thing, whether it's 3-day stiff sickness vaccine, Rift Valley fever, a red water, a gall sickness, blood vaccine, if you still get that today, and any of the other IBR or these BVD vaccines that are live, and we call them hot. Hulle is warm. Hulle is nog sterk, die virusse. Don't give them close to bull testing. Okay, why? Because if they have any effect on the bull's fertility, it takes about 8 weeks for that bull to produce new. They produce new semen every day, but it takes 8 weeks to clean it out from the babal, the epididymis, there where it goes through that maturation process. So it takes about 8 weeks before a new supply comes out of the other side, all right? So it means that you can have potential infertility in the bull for that period. So it's important not to give those kind of vaccines, whether it's a red water or hot water, anything that can potentially cause a viremia, a live virus, or anything that can cause a temperature reaction. Those blood-borne tick vaccines, very important. All right. Okay, so that takes us to the end of the bull information. So just ending off, there are 2 graphs that I could have shown, but it goes back to body condition score, liggaamskondisie telling. So when your cow or heifer is about to calf down, 2 weeks, I'm just going to fast forward, guys. That's just about, so body condition score is directly related to a potential conception percentage, and also the better the body condition score of the cow or the heifer at about 2 weeks to calving, up to calving, in that 2-week period. What her body condition scoring is there will kind of be a guideline for you to know what your reconception percentage will be on the first heat. So the better her BCS is, the shorter the calving to first heat is, and also the higher the percentage of females that conceive on that first heat. But not only does it have that effect on them, it also has an effect on the serum of the cow, which or the milk, where she's producing the colostrum. So die bies wat sy in haar eier uitskei. So the colostrum, the bies that she's passing out in the bies in the colostrum. The calf sucks it, within 6 to 8 hours it's absorbed, thereafter not, then it's digested. Those antibodies we can measure, and the most important one is this IgG, immunoglobulin G. So that antibody, which is passed from the mother to the calf, key of life, which will protect the calf very well for the first 3 months. Okay, and that's why we start then vaccinating at 3 months. If the cows are not immunized like that, you can start vaccinating earlier. But as a sort of general rule, we will start vaccinating the calves at 3 months. So there's a direct correlation. So if she's got a bad body condition, guess what? Her immunoglobulins, haar teenliggaampies wat sy uitskei, is baie laag. So daai kalvers word gebore 22 tot 17% minder teenliggame in hulle liggame. Okay, wat hulle deur die melk inkry. And you can't change that. A cow is like a big boat, and a sheep and a goat, small stock, are like little speedboats. You can't change that cow's body condition score in 2 weeks. You can do that with a nanny goat and a ewe. Jy kan dit doen met 'n ooi en jy kan hulle lekker opstoom. And that means that you can push up the antibody levels. So the condition of the cow, if that's managed correctly, you'll have optimum antibody levels. And you don't necessarily have to vaccinate 1 month before calving. Okay. Of course, the level will not be the same as a cow that you vaccinate 1 month before calving. But if you go and vaccinate cows 1 month before calving, you're also putting a lot of pressure and stress on those cows. And you can have the odd cow aborting through rough handling, bumping, high cortisone levels being produced. So if your vaccine program is in place, it's just a question of you just ticking the box every year. And your herd will tick along. And then the main responsibility after that is nutrition. That's why I started off the talk with nutrition and I ended off with nutrition. Because food, skafting, is the most important part. I see some guys' heads are dipping here because their energy levels are going down. All right, so Gobus and from the Simra breed, thank you very much for this opportunity to just give you a little bit of a fast oversight on a beef herd program that you can consider. And if you're not doing it, talk to your local vet. And otherwise, my details will be available at some stage. It's quite easy. I'm just going to pass through all these. And I'll just finish off there. Sorry, I kom werksaam. All right. So I just ask people to contact me. I have a disclaimer. They fill it in. And that's how I start interacting. Because I'm not Dr. Google. And I don't mean to become one. If you use my time, I have to be remunerated in one way or another. So that is the rule of life, unfortunately. But thank you very much for that. Thank you, Kobus.